OSCE number 19, Clinical Dental Exams Part 2. Disclaimer, this video is not affiliated with Royal College of Surgeons or General Dental Council. No feedbacks were used. So guys, welcome to my channel. If you find this helpful, do shout out, like and subscribe. Today I'm doing a different style of OSCE. It's exam situation OSCE. This is intended to help ORE, LDS, MFDS, MJDF candidates giving Part 2 exams. It's also helpful for any dental OSCE style exams. By the way, this picture shows the beauty of Lahore. For today is, first of all, you need to sit comfortably alone with a piece of paper and pen. Secondly, I have a countdown timer for 1 minute, so I will be timing you. Give yourself 1 minute to read the question. Thirdly, you will have 5 minutes to formulate your own treatment plan. So again, I will provide a countdown timer for you while I will go and make myself a hot drink. I will present my treatment plan in 5 minutes. And then we will both sit and analyze the treatment plan, compare mine with yours, add and subtract stuff from the treatment plan as you wish. And in the end, do subscribe and give me a feedback on my YouTube channel. You have 1 minute to read the question. Are you ready? Get set, go. Now, in the next slide, you will have a countdown timer for 5 minutes, whereby you sit down and you formulate a treatment plan. Ready? my treatment plan now. I will also have 5 minutes to present my treatment plan. Hello, Mr. Smith. My name is Ms. Priya Khan and I will be your dentist today. Can you please confirm your date of birth? Mm-hmm. Right. Mr. Smith, I understand you're here about the frequently occurring ulcer in your mouth, and I am so sorry to hear about the pain you're experiencing due to it. But don't worry, I'm here to help you and will take care of you. The ulcer in your mouth is called recurrent aphthous ulcer. Don't worry about its long name. In simple words, it's a recurring ulcer or a break of your skin which is not dangerous but unfortunately annoying as it keeps occurring again and again. I will explain why this ulcer is occurring. It may have one or several factors. It could be due to the low iron reserves in your body. Due to the abdominal cramps, you could have an ulcer or losing blood. I would refer you to your GP to help you increase the iron reserves in your body. Either it would require further investigations or may require supplemental medications. GP would be the best person to guide you. I would suggest you to modify your diet to add more leafy green vegetables, meat, and have a balanced diet. Nuts could be a cause of ulcers or exacerbate its symptoms. I would suggest to avoid spicy food or nuts. Use a straw for your fizzy drinks. Spicy nuts could have preservatives and new ingredients which could cause these ulcers. Stress again can exacerbate the symptoms, so I would suggest you control the stress, engage in hobbies you like. I would also refer you to your GP for advice and medications if needed. The broken tooth, due to its sharpness, could be a factor for causing the ulcer. It could cause trauma around that area. Today, I will briefly tell you its management and help you out of the pain and reduce its frequency of occurring in your mouth and eventually keep it at bay. You have an option to pick and choose from my treatment plan, and you always have an option of no treatment. As you are in pain today, it's my duty of care to get you out of pain. So, for emergency phase of my treatment plan, I will give you Ora gel or Bonjela. I will also prescribe Deflam mouthwash, which can be used every 1.5 hours or as and when required. It will relieve you of the pain you're experiencing and make it very comfortable for you. I will also give you cortical mouthwash to heal it quickly. As there's a broken tooth next to the ulcer, I will provide a temporary dressing for you today. As the main management, during the second visit for the sharp tooth next to it, I will give you option of no treatment, a filling of GIC, amalgam or composite. Advantages of GIC is that it contains good fluoride which strengthens the tooth, but disadvantages it does not last very long. While composite filling on the other hand will match the tooth color, but disadvantages it can lead to sensitivity due to its shrinkage. Amalgam is the strongest of the filling materials, but disadvantage is its metallic color. As for the ulcer, I will note its size today, and if the ulcer persists over 2 weeks' time, I will refer you to the specialist for some steroid treatment or biopsy where they take a small sample of the ulcer or the skin and view it under the microscope. For maintenance, I would recall you at regular intervals. I'm happy you are doing an amazing job as you have quit smoking. Keep up the good work. Finally, I will give you written advice about the ulcer and the filling material choices, and you can go home and read through it at your leisure. Mr. Smith, I hope you understood everything. Do you have any questions? Thank you. This next slide is basically a treatment plan comparison. The most important thing is the time management. Besides the excellent knowledge, you must have an empathetic delivery style covering advantages, disadvantages, and risks of the treatment plan, which has been mentioned. Start with an introduction. Don't call yourself doctor, say Mr. or Miss. Say sorry if the patient is in pain. Explain all the difficult medical terms in an easy, simple language. You can divide the treatment plan into sections like immediate emergency phase, preventive or stabilization phase, the main management phase, maintenance, and summarize only on if you have time. Finish with any questions. Thank you. They all bear 1 mark, so they are extremely important. Next, what I'm going to do is I'm going to give you a transcript that I used, and we will go through it together to try and see if we can pinpoint any extra points which have been missed out. So this is the transcript that I used. So when I started off with, "Hi, Mr. Smith." So instead of asking his name when you approach the patient, it's better that you say his name when you start the conversation, as it would save you time. What I did next was that I introduced myself as Miss Priya Khan. So instead of Dr. Priya Khan, Miss Priya Khan is better. And next, I asked him to confirm his date of birth. You can at this point say, he was born on the 14th of 7, 1978. So you can say, "Is this your date of birth?" 14th of 7, 1978. That would also save you a bit of time, but it's totally up to you. Next, I explained the ulcer in a very simple word, which was a break of his skin. And any difficult medical terminologies, if used, like recurrent aphthous ulcer, you need to break them down and explain it like you are explaining a 7-year-old child. The other phase was an emergency phase, which is also what you plan to do today for the patient to relieve him of any symptoms that he's experiencing. It's also called an immediate phase. Here we have the preventive or the stabilization phase, whereby you need to make sure you stabilize his dentition and prevent further problems from occurring. So this is the main management for the patient, and make sure you always give advantages, disadvantages, and risks. I have put that as 2 advantages, disadvantages, and risks. You can modify as per the time that you have. Over here, also remember to give the option of no treatment for the patient. The main maintenance phase is a very important phase not to miss out, whereby you can patient about the recalls and about any brushing advices that you might give to the patient. Feedback is important as well, whereby for this patient we gave him leaflets, and whereby the patient can go home and read. Always finish off with a bright smile and eye contact, I must say. Always ask the patient if he has any questions. This is the time where the patient may ask you questions, and there could be a bit of interaction here. And finish your OSCE off with a thank you, which would also give you a point. Right, so that's the end of my OSCE exam scenario. I would love to have your comments and suggestions. Feedbacks are welcome. Don't forget to subscribe to my YouTube channel, as this is a very new channel, and I will be posting more exam related videos. Have a good one.